Good morning. Today we're going to talk about bloodborne pathogens and infection control. The training objectives today will be to identify the bloodborne pathogens and certainly understand how the diseases are transmitted, determine risk of exposure, how to protect yourself, how to respond if you are exposed, and understand your right to medical evaluation. So what are bloodborne pathogens? There are three basic types: bacteria, virus, and fungi. Let's talk about bacteria first. Bacteria is the simplest of creatures that are considered alive. They are everywhere. We do have good bacteria that lives within our bodies, but we also have bacteria that is bad for our bodies. And bacteria is very prolific and doubles every 20 minutes. So E. coli and Salmonella are two kinds of foodborne pathogens, and they can live up to 2 hours on surfaces like doorknobs, keyboards, and tables. Hot water does not kill bacteria. Only temperatures over 140 degrees can kill them. So if you think that just heating water can kill them, that is not true. And bacteria can build up resistance to drugs, which is antibiotic resistance, which is intended to kill them. Now, viruses are rather different. They're a tiny organism that can lead to mild or severe illness. Viruses are not alive by themselves. They have to invade a cell to multiply. Viruses can be transferred from a dry, smooth surface, and they can live up to 20 minutes on a surface. And some viruses, such as chickenpox or tuberculosis, can travel on droplets through the air. Fungal infections. The reason I included this, they're very, very difficult to kill, and they do live in air, soil, and plants, and some do live on the human body. One of the more common ones is athlete's foot, which is very, very difficult to get rid of. And they are produced in tiny spores in the air. And they can start in the lungs or on the skin. So what is the definition of bloodborne pathogens? These are all the secretions or fluids that we have in our body, which are called, and they can be potentially infectious materials. We have about 3/4 of our body is made up of fluid, and it's actually all of these fluids that are included. We have three specific types of bloodborne pathogen that we're going to talk about: Hepatitis B virus, Hepatitis C virus, and human immunodeficiency virus, which is HIV. So how are they spread? They're spread by directly touching body fluids from an infected person. This is why in hospitals everywhere you see gloves to be able to use as a barrier. And this includes contact with lesions, open wounds, sores on the skin. It also includes mucous membranes, which is the lining of the mouth, nose, throat, and eyes. So they're also spread by indirect contact, by touching objects that have touched the blood or another body fluid of an infected person. And also vector-borne, by receiving an infected animal or insect bite. This is why we are so careful about bats, about students touching bats, and that could be a vector. And again, we talked a little bit about airborne pathogens in tuberculosis and varicella, as we said. And we can actually get sick by breathing in those droplets from an infected person when they cough or sneeze. This is why it's so important to cover your mouth when you cough or sneeze. Bloodborne pathogens can be transmitted in following ways: by sharing dirty needles, mucous membrane exposure, sexual contact, and blood transfusion before 1992, before they actually controlled blood transfusions, and pregnancy. I wanted to show you a little bit about how the liver works before we talk about hepatitis, because all the hepatitis B and C that we're going to talk about, actually affect the liver, and it's one of the largest and most important organs of the body. It's a cleanser of the body, and it gets rid of waste product, and also drugs and alcohol. And it's also a storage unit for vitamins, sugar, hormones, and can be released into your bloodstream when you need them. So what happens with hepatitis B, which affects the liver, and it's really amazing, it's 2 billion people worldwide that are infected with hepatitis B. And you have much more chance of being infected by hepatitis B than HIV. However, there is an immunization for this virus, and at-risk employees that work in high-risk areas within the facility, if you have not had the series, there's a series of 3. You get the first one, and then a month later you get the second one, and then 5 months after that you get the third one. If you have any concerns about where you're working, or if you have not had it, please talk to HR. Hepatitis C is also found in the blood. It multiplies quickly, and it infects the liver. And you can see here how it actually ends up making holes in the liver, and you can't live without your liver. It can take years, though, to notice the symptoms. There is no immunization for hepatitis C, but it can be cured by a liver transplant. So again, with hepatitis C, there's about 4 million people in the U.S. that have been infected, 4 times more common than HIV. And many people who have viruses, specific types of virus, don't even know they're infected. And hepatitis C is the leading cause of liver transplants. Let's talk a little bit about HIV/AIDS. Human immunodeficiency virus has wiped out a generation of people, left millions of orphans. However, over the last 20, 30 years, over half of the population affected are women. And at one time, this was strictly, when it was actually named in the early 1980s, it was basically found in the large cities, New York, Los Angeles, and it became at that time, we were starting to see specific symptoms in gay population at that time, gay male population. And 1 in 5 are unaware that they're infected. So who's at risk for these diseases? We all are. So what would be the most important way of protecting yourself? These are all pretty good answers, but the one that really stands out is hand washing. It's very basic, and you can certainly control the infection. So please be aware, when you go into the bathroom, please be aware of what you're doing as far as washing your hands. Many people, believe it or not, do not wash their hands. So if you're coming into the bathroom, assume that that person before you has not washed your hands. So when you come out of the bathroom, please make sure you're not going to touch anything. You're going to wash your hands, you're going to turn off the faucet with a paper towel, and as you go out of the bathroom, you're also going to touch the doorknob with that paper towel. You can take that to wherever you are where you can actually put it into a wastebasket. But make sure you touch nothing in that bathroom. Because remember, on that doorknob, that bacteria can sit for 2 hours. So to reduce the risk, both employees and employers need to work at reducing the risk of exposure. So again, you need to know how bloodborne pathogens can affect you, how you can become infected, and know how to protect yourself. So this is basically saying that TSD must give you the tools to do your job. If you need gloves to do your job to keep you safe, or a mask, or special uniform, then it is up to Texas School for the Deaf to do that for you. This is a Sharps container, and I left this in because If you ever come across anything on the campus that looks sharp, and you have no way to dispose of it, please bring it to the health center, because we do have these sharps containers. Do not put it in something that's flexible. It needs to be rigid so no one can hurt themselves. So if you find anything that is sharp, please put it in something like a box or something rigid and bring it to us, and we will make sure it's disposed of properly and safely. Safe work practices. Again, Texas School for the Deaf needs to reduce your risk, but also if you see a spill, for instance, please clean it up or call housekeeping to do that, and just be careful and use handrails and so on, so to keep yourself safe. Again, this is just saying that if you need them, personal protective equipment will be supplied by Texas School for the Deaf. This is the exposure control manual. This is a wealth of information in this book. This tells you if you are exposed, the different forms to use, and to bring them to either HR to help fill out, or also to the health center. This will tell you, it's very detailed, who is at risk, what is done to reduce risk, and all the record keeping that you will need. So, and again, the forms for sharp injury, if you're cut or something punctures your skin, it will tell you what the procedure is. So again, treat everyone as if they have a bloodborne disease, because you do not know who is infected, and sometimes that person themselves doesn't know if they are infected. If you come across something sharp, please throw it away in something that cannot be punctured, or bring it to us at the health center. So Texas School for the Deaf, for your protection, has established a written program, which is the manual, developed engineered controls, which means they've given you the personal protective equipment to protect yourself, established post-exposure procedures, which are in the manual, and annual training, which is this. So your responsibilities: you need to be able to protect yourself by learning about the hazards of bloodborne pathogens, know what to do if you are exposed, treat all body fluids as if they are infectious, and follow safe work and personal practices, and wear the appropriate personal protective equipment. So, key points to remember: bloodborne pathogens can cause fatal diseases. Be aware, take universal precautions, and use safe work practices. Understand and follow exposure incident procedures. Report exposure incidents. If you have questions, you can always contact the health center, myself, or two of the supervisors, Angela and Diane. We're available to answer your questions. Thank you.